Fairfax County's Diversion First initiative is not a singular program. It is a continuum of services which offers alternatives to incarceration for people with mental illness, substance use disorders, or developmental disabilities who encounter the criminal justice system for low-level offenses. The program aims to prevent repeat encounters with the criminal justice system, improve public safety, promote a healthier community, efficiently utilize resources, and most importantly, help people who are in crisis recover and take control of their lives. Diversion First was launched in 2015, following recommendations from the Ad Hoc Police Practices Review Commission and the Fairfax County Board of Supervisors' adoption of a resolution to decriminalize mental illness by joining the National Stepping Up Initiative. Here are some key elements of Diversion First. So how does someone encounter services within the Diversion First system? Along with many other jurisdictions throughout the country, Fairfax County uses the sequential intercept model as a framework to inform strategies and community-based responses related to the involvement of people with behavioral health issues involved in the criminal justice system. This model identifies how this population flows through the criminal justice system along 6 distinct intercept points, each with possibilities for intervention. Diversion First now includes services at each intercept. At Intercept 0 and 1, thousands of first responders and magistrates, probation officers, and dispatchers have received crisis intervention team training and mental health first aid, providing the tools needed to understand behavioral health issues and de-escalate crisis situations. Crisis response teams provide community-based services. In addition to mobile crisis units comprised of clinicians, co-responder teams pair a CIT-trained officer and a clinician to respond to calls for service related to behavioral health. Additionally, community response teams provide outreach, engagement, and care coordination for people in the community who are frequent utilizers of public safety services. Located at the Sharon Bulova Center for Community Health, the Merrifield Crisis Response Center, or MCRC, operates as an assessment site where Crisis Intervention Team, or CIT, trained law enforcement officers are on duty 24/7 to accept custody when a patrol officer brings in someone who's experiencing a behavioral health crisis. Law enforcement officers may transport individuals to the MCRC because they are diverted from potential arrest, if they are under an emergency custody order, or if an officer recognizes that they need behavioral health services. At the MCRC, clinicians provide assessment, crisis intervention services, medication management, 23-hour beds, and other needed services to support people who are in crisis. Peer recovery services are also available at the MCRC. Diversion First also provides opportunities for intervention throughout the criminal justice system. Individuals booked into the local adult detention center are screened with standardized tools to identify behavioral health issues, and an array of behavioral health services are provided, including assessment, crisis intervention, medication evaluation, and case management. A jail-based addiction treatment and recovery program established by our sheriff, Striving to Achieve Recovery, or STAR, is led by certified peer recovery specialists, with support from jail-based behavioral and medical teams. Medication for opioid use disorder is also offered in the Adult Detention Center. Opioid use disorder is a chronic but treatable health condition, and medication allows individuals to transition from a life of addiction to a life of recovery. In addition, jail-based teams provide post-release re-entry services, such as linkages to treatment, healthcare, and housing. The court system is also a key Diversion First partner. A supervised release program provides intensive pretrial supervision in the community, reducing the number of people who are incarcerated. Pre-trial services provide both accountability and support, and reduces the number of days spent in jail. 3 specialty dockets, the Veterans Treatment Docket, Mental Health Docket, and Drug Court, provide diversion through a structured process that integrates treatment and court supervision, providing a path out of the criminal justice system. Diversion First also includes a robust system of community-based behavioral health treatment, peer recovery support and housing to support stability, self-sufficiency skills, and long-term independence.
Diversion First is possible based on the commitment and partnership between multiple agencies who work collaboratively to serve this vulnerable population. This collaboration has resulted in a collective mission, co-located staff, shared protocols, and tremendous culture change. Broad County involvement from the onset of Diversion First has also been essential, with multiple county agencies providing critical guidance, support, and willingness to advance innovative solutions to barriers such as disparate data systems and data sharing. Frequent communication among stakeholders, including public and private partners, healthcare systems, and community members, has led to increased resource efficiency and ultimately better results for our community. The momentum for Diversion First continues, and Fairfax County continually assesses our progress by identifying service gaps and improvement opportunities and expanding programming based on data and evolving community needs. The continuum of Diversion First services was built over several years. Counties interested in developing diversion programming can implement components over time and may begin their efforts by assessing current services, gaps, evolving community needs, and data over several years. In addition to the intangible value of providing positive, life-changing alternatives for those caught in a cycle of criminal justice involvement, diversion efforts result in significant cost avoidance by reducing incarceration, public safety resource involvement, emergency department visits, unemployment, and negative impacts on families. With sustained commitment and common mission to reduce arrest, incarceration, and recidivism, and serve those with behavioral health issues, diversion programs are achievable and transformative, and ultimately strengthen communities. For more information, please visit our website